Hello again. We're going to continue in this video lecture to discuss HIPAA legislation and other aspects of health information management. Medical liability is basically addressing malpractice. The threat of excessive awards in medical liability cases is increased providers' costs. And as a result, these costs get passed on to, you guessed it, the patients. Some providers stop practice medicine in certain areas of the country where liability insurance costs are the highest. This reduced access to medical care and caused a lot of problems. While there are individual states who have passed some sort of medical liability reform, the United States Congress is also formulating separate federal medical liability reform legislation. 2016, the Centers for Medicare and Medicaid Services released their final regulations for the implementation of the Medicare Access and CHIP Reauthorization Act, the MACRA, a Medicare reform law that repealed the sustainable growth rate formula and created the Quality Payment Program. MACRA also incorporated the Standard Care Protection Act. HIPAA, as we talked about earlier, has several sections of it, and one that you'll be dealing a lot with in health information management is the privacy rule. The standards for the privacy rule cover individually identifiable health information. This covers security and confidentiality of the PHI. The rule provides rights for individuals with respect to protected health information about themselves and mandates compliance by everybody who is a covered entity. That's individual physician offices, hospitals, insurance companies, data warehouses, and everything else. Protected health information, or PHI, is information that's identifiable to an information and has individual identifiers such as name, telephone number, Medicaid ID number or other medical record numbers, name of employer, address, date of birth, social security number. If it has any of this, it is considered PHI, falls under the privacy rule. All medical records and any other individually identifiable health information that's used or disclosed, whether electronically, paper-based, or verbal, are covered by the privacy rule. And patients have specific rights under this. The rights include patient education on privacy practices, redisclosure of PHI, patients having access to their own records, and so on, as illustrated here. Covered entities do have the flexibility to establish their own policies and procedures to meet privacy rule standards. They need to create written policies and procedures, train employees, and the one thing that's a non-negotiable item is to designate a privacy officer. Covered entities are required to limit the use of PHI to the minimum amount necessary. The minimum necessary provisions do not apply to provider requests for treatment, individual disclosures, or any HIPAA compliant transactions. The following penalties apply when covered entities misuse personal health information. These can include monetary penalties of $100 per violation, federal criminal penalties up to 50,000 and 1 year in prison, and the HITECH Act of 2009 increased civil penalties for willful neglect up to $250,000. The HIPAA security rule is a separate section of HIPAA, and it covers standards and safeguards to protect health information that's collected, maintained, used, or transmitted electronically. Healthcare business associates and their subcontractors must follow the HIPAA security rule for electronic protected health information, the EPHI, under the HITECH Act of 2009. Customers of all health plans must be assured that the integrity, confidentiality, and availability of electronic protected health information is protected. The purpose of the security rule is to adopt national standards for safeguards to protect this. Prior to the publication of the security rule, no standard measures existed to address all aspects of the security of the health information while it was being stored or during the exchange between entities. These provisions include the following policies and procedures. They need to define authorized users of patient information to control access. They need to implement a tracking procedure to sign out records to authorized personnel. They need to limit record storage access to authorized users and lock record storage areas at all times and require that all original medical records remain in the facility. HIPAA security rule standards also include the following safeguards: the administrative, the physical, and the technical. And these are illustrated in tables 9-1A, 9-1B, and 9-1C. Please pay special attention to these three tables. In the United States, protecting health information is generally divided between coverage for record-keeping systems that are maintained by the federal government agencies, right? These federal protection measures are found in constitutional law, privacy acts, and other statutes, and also state government agencies, as illustrated in Table 9.3. These laws define the types of confidential health information and the circumstances where the information can be shared without patient authorization. And then finally, we have information that's maintained by the private sector. These are regulated by laws that address specific types of organizations. So if we have protected health information, we at some point need to transmit it when people go to a different physician, go to a different hospital, and so on. Healthcare professionals have the responsibility of maintaining this confidentiality and appropriately disclosing the information if it's requested to do so. It's important not only to appropriately release the patient's information, but also not to include information about another patient, also privileged information like peer review or quality management documents, correspondence or notes from attorneys, any aberrant or deviant statements, and so on. Both HIPAA and the state confidentiality laws control the disclosure of information from patient records. And when we have an authorization to disclose PHI, we have to be clear on when we need a authorization and when we do not, right? Like we talked about in HIPAA with the treatment, payment, and operations. We need to address patient access to records, accounting of disclosures of PHI, and prohibiting redisclosure of PHI per state and federal law. Now, again, we don't need authorizations for all disclosures of PHI, as you can see here. Health oversight, whether it's a quality improvement, regulation, accreditation, licensing, may require access to PHI. That is okay. Also, law enforcement, also okay. Research, specialized government functions, public health, judicial and administrative hearing, decedents who are dead over 50 years, the FDA, and of course, workman's comp. If you think about it, most of this makes sense. In the case of public health, if you're going to have reportable diseases, you can't get authorizations to find something that's mandated that you report anyway. Likewise, with workman's comp, if somebody has a workman's comp injury, you can't not release the information and then claim to have an injury. So a lot of these things are a little bit more straightforward than they may see. And again, individuals generally have the right to access PHI for the purpose of inspection to obtain a copy, except in some of these following cases. Psychotherapy notes. And again, the exact restriction will vary a little bit from state to state, but under federal law, these can be restricted if the psychotherapist believes that releasing them may cause harm to the patient. Also, any information compiled for use in a civil, criminal, or administrative action. A covered entity can deny an individual to right to access their PHI if the PHI is exempt from the right of access for any of those, or either of those, I should say, situations above. And an individual's access to the PHI was created or obtained by the covered entity during research, or if the covered entity is correctional institution, or if it was covered, obtained by somebody other than the covered entity under a promise of confidentiality. The covered entity also may deny an individual access to PHI, provided the individual is given a right to have the denials reviewed. And they give some examples here. A licensed healthcare provider has determined the access will endanger the life of the individual or another person. PHI makes a reference to another person. And releasing this to the patient will determine, may cause the person to harm another person, or the request for access is made by the individual's personal representative and the PHI refers to another person and the healthcare provider has determined the access is reasonably likely to harm either the individual or the other person. And that's all I have for you. Come back for our last video lecture where we'll wrap up our discussion of legal aspects of health information management. Bye now.